Tonight on the programme, Russian spies and NZ, Claire Curran and RNZ, and Mycoplasma bovis and MPI. But we begin tonight with the county's Manukau DHB and 4 Middlemore hospital buildings that are full of rot and potentially dangerous mould. This was broken by our colleagues Phil Pennington and Ruth Hill on Morning Report. Meanwhile, Checkpoint, as you'll know, has been looking at growing DHB debt and the pressure on DHBs to stay in surplus. Tonight, those two strands meet because the acting CEO of the county's Manukau DHB tells us spending what they needed to on building remediation would have put them in deficit, and they were under pressure to stay in surplus. I spoke to Dr. Gloria Johnson earlier this afternoon, and she began by telling me about the scoping and assessments to identify the extent of the problem with buildings at Middlemore.
And we've identified that we've got problems in multiple buildings over 4 main areas. We have the recladding issues in 4 buildings and less serious recladding issues in a number of other buildings as well on various sites. But those recladding issues in the 4 buildings on the Middlemore site are obviously all particularly serious ones. We also have asbestos issues in a number of buildings. We have seismic issues in a number of buildings, and we have serious deferred maintenance issues in buildings as well. And some of our buildings have all of those problems together.
Why hasn't something meaningful been done before now? The independent appraisal by Robertson & Co. says issues were identified in the Scott building in 2012. We're talking about weather tightness here, so we are talking about leaking, mould, rot. Scott building 2012, Kids First 2013, the super clinic between 2012 and 2014. So that's 4 to 6 years ago. Why wasn't meaningful remediation undertaken?
So, with regard to the recladding issues in particular, some of the delay was because of the decision to actually pursue legal action against the contractor,
Hawkins.
And that then became caught up in a very protracted process that only got resolved by the beginning of last year. But in general terms, I think we have a problem with a reluctance to actually identify the scale of the problem and therefore the cost and the effort that might be required to fix the problems because of a belief in the health sector that we were not going to be able to actually get the capital investment required and that we were not going to be able to afford to engage in the work. And I think this is true not just of the need to remediate buildings, but to also invest in new buildings. So we're way behind with that as well. And I think that we have been in a position of kind of assuming that there was no point in asking because we wouldn't be able to actually get the financial support that we require.
Okay, that's really big. So why were those assumptions made? Were you or your predecessors explicitly told, do not put a business case in for this remediation because there is no money?
No, we certainly weren't explicitly told that. But what we do know is that particularly from the time of the Christchurch earthquakes onwards, when obviously a lot of resource was having to be diverted into dealing with the issues in services there, we were certainly given to understand as a sector that there was very limited capital available for other things. And I think that the ministry itself, and I know Treasury, in fact, had become increasingly frustrated in recent times about feeling that they actually didn't know what the size of the problem was in the health sector because none of us were putting forward cases because, you know, it costs quite a lot to actually work up a business case. So you're not going to do it.
Yes, it does.
Unless
Yes, it does.
It's going to get across the line.
And look, I've got the Treasury document because I've been looking at the overall cost of the CapEx that needs to be done just to get DHBs to where they ought to be, not to future-proof them. And I've got a Treasury document that says, and I quote, some DHBs look to be sweating their assets and underfunding repairs and maintenance to help balance their books. Was that you?
Yes, I think that was.
Okay.
I think that's another issue as well. Yes,
okay,
absolutely.
So that was you. Why were you doing it? Why was the DHB doing it? In other words, either the pressure was direct and explicit, or you guys were surrendering to shadows.
Well, DHBs have certainly been under very explicit expectations from ministers to meet their financial targets, to operate within their budgets. And what we know, of course, is that particularly because of the capital charge system in this country, if we do if we do spend capital, then we get charged interest. We also acquire depreciation, and that then affects our operational budgets and runs the risk that we will run into deficit. It was certainly recognised in our DHB that if we invested as much as we thought we would need to, both in developing new facilities and in remediation, then that would inevitably lead us into a deficit position.
And if I look at your, I'm sorry to interrupt, but I just want to, I really want to see this materially and meaningfully expressed. The county's Manukau DHB annual plan 2016-17. The DHB explicitly tells the ministry and the minister clear indications from the minister and Ministry of Health are of continued and significant tightening fiscal position. Now, this is from your annual plan. The annual plan goes on to say, as a result, increasingly tough decisions have been made and will continue to be required, right? That was your position.
Yes.
And that meant that you had rotting buildings that you weren't doing remediation on, right?
Yes, it meant that there were a lot of things that we weren't doing, I guess, in order to be able to reprioritise the money to the things that we thought were most important.
I'm sorry to interrupt, but this is really material. And the money that you were reprioritising, it seems to me from your annual plan, was being reprioritised to keeping you out of deficit. And there is a letter in your and there is a letter in your annual plan from Jonathan Coleman dated 27 October 2016 entitled Living Within Our Means, and it says, I am pleased to see that your DHB is planning a surplus for 16-17 and for the following 3 years. So were you not doing the work that was required because your minister wanted you to stay in surplus?
Yes, I think the government, and I think the whole government has expected the health sector to be able to live within its means. And in order to do that, we have had to compromise on our capital investment programs.
But living within your means here is such a false economy, isn't it? Because you now have these stinking, rotten, and potentially dangerous buildings.
Yes, but even more urgently, we have a need for new buildings to develop additional capacity to deal with the rise in demand. And that's why we actually consider that to be our more urgent problem. We can't afford to wait until we've finished all the remediation work before we start investing in new capacity, because we need new capacity now as well.
So, sorry, forgive me. So to paraphrase, what you're saying there is, if you remediate these crappy, stinking, awful old buildings, actually increased demand, the growing population out there, means that you are spending a whole lot of money and it will still be inadequate.
Yes, remediating those buildings will not increase our capacity, and we need additional capacity even more urgently than we need to remediate the buildings.
Do you need to knock them down and start from scratch?
Well, that's one of the things that you start to wonder. We certainly are aware of that with one of our buildings in particular. So we have a building called the Galbraith building, which is actually two buildings joined together. We've got a number of clinical services in there, including the entire maternal health service, which is the biggest maternal health service in the country. That building has multiple problems with it, including serious seismic issues as well as asbestos. And we are currently getting quotes on what it would take to be able to remediate it, to deal with the seismic issues in particular, taking into account that any remediation is likely to disturb asbestos, which will make it even more difficult and expensive. The building not only houses clinical services but has critical infrastructure for the rest of the campus, the other hospital buildings running underneath it and a plant room in it. We suspect that the cost of remediation is going to be at least the same as what it would cost to build a new building. And if we remediated it, we would still have a very old building. It's a 1960s building. So in fact, probably the right option for it is to build a new building instead and then knock it down. So we certainly are at a point where we do need to consider to what extent it's actually worth investing in the remediation of old buildings when maybe what we really need to do is to be investing in new buildings to replace them.
One final question, and this is the big one, I guess. How much are we talking about here, all up, to either meaningfully and reasonably remediate, or to start from scratch and do what you're talking about, which is get it right as a greenfields project?
I'm not sure what it would cost to do an entire greenfields project. I do know that the 5-year plus program that we've got at the moment for remediation and building new buildings on the Middlemore site and our other sites in order to expand to meet medium-term demand is in the order of $1.6 billion. I expect you could probably get an entire new major acute hospital for a similar amount of money. The reality is we may need both, given the growth in Auckland.
Dr. Gloria Johnson, who is the acting CEO of the county's Manukau DHB. The Health Minister, Dr. David Clark, declined an interview. He has a meeting with the acting chair of the county's Manukau DHB later this week. In a statement, he said the previous government neglected and underfunded our hospitals. This government is committed to a well-funded public health system, but the reality is that the legacy of underfunding will take some years to turn around.